Welcome to the Practical Behavioral Care Podcast. Before we begin, I want to share a brief disclaimer. This podcast is for educational and informational purposes only and is not intended to provide medical advice, diagnosis, or treatment. If you have concerns about obsessive-compulsive disorder or any mental health condition, please consult a qualified healthcare professional. Today's episode focuses on obsessive-compulsive disorder, or OCD, a condition that is often misunderstood or misrepresented. In this episode, I'll explain what OCD actually looks like, how it shows up in everyday life, and what scientists believe causes it. My goal is to make OCD easier to recognize and to remind you that effective help and treatment are available. Obsessive-compulsive disorder is a mental health condition defined by the presence of obsessions and compulsions. Obsessions are recurring, unwanted thoughts, images, or urges that cause significant distress. Compulsions are repetitive behaviors or mental acts performed to relieve the anxiety created by those obsessions. When left untreated, OCD can interfere with daily routines, relationships, work, and overall quality of life. What makes OCD especially challenging is that people often recognize that their thoughts or behaviors don't make sense, yet still feel unable to stop them. Obsessions are intrusive and distressing thoughts, images, or urges that repeatedly enter the mind despite efforts to ignore or suppress them. These thoughts are not pleasurable or intentional, in fact. They often go against a person's values and beliefs. Common obsession themes include fears of contamination, worries about causing harm to oneself or others, concerns about morality or religious correctness, and a strong need for order or symmetry. These thoughts can trigger intense anxiety, guilt, fear, or shame, making them especially difficult to manage without support. Compulsions are behaviors or mental rituals performed to reduce the anxiety caused by obsessions. Some compulsions are visible, such as excessive hand-washing, repeatedly checking locks or appliances, or arranging objects in a precise way. Others are internal and less obvious, like silently counting, repeating phrases, mentally reviewing past events, or seeking reassurance in one's own thoughts. Compulsions are often driven by rigid internal rules, and while they may provide brief relief, they usually reinforce the cycle of OCD and become increasingly time-consuming and exhausting. OCD can present in many different ways. Some common forms include contamination OCD, which involves an intense fear of germs or dirt and leads to excessive cleaning or avoidance. Checking OCD, marked by repeated checking of doors, locks, stoves, or appliances to prevent imagined harm. Hoarding-related difficulties, where discarding items feels impossible due to fear of loss or perceived need. Intrusive thoughts, including disturbing violent, sexual, or blasphemous images or impulses that are unwanted and highly distressing. Symmetry or ordering OCD, characterized by a powerful need for items to be arranged just right or actions to follow a specific order. Not everyone with OCD experiences the same themes, and symptoms can change over time. OCD does not have a single cause. Instead, it develops through a combination of factors. Genetics play a role. OCD tends to run in families. Biological differences in brain circuitry and neurotransmitters, particularly serotonin, affect how the brain processes worry, fear, and habit formation. Environmental factors can also contribute. Stressful life events, trauma, and certain infections have been linked to the onset or worsening of symptoms in vulnerable individuals. It's usually the interaction of these factors that leads to the development of OCD. OCD is a real and potentially disabling condition, but it is highly treatable. Many people experience significant improvement with evidence-based treatments such as cognitive behavioral therapy, especially exposure and response prevention, often called ERP. For some individuals, medication can also be an effective part of treatment. If you or someone you know is struggling with intrusive thoughts or compulsive behaviors, reaching out to a mental health professional is an important and empowering first step. Understanding OCD is the first step toward compassion, healing, and recovery. With the right support, people living with OCD can reduce distress, reclaim time, and improve their day-to-day lives. Thank you for listening to the Practical Behavioral Care Podcast. If this episode resonated with you, consider sharing it with someone who might benefit, and remember, seeking professional help when needed is a sign of strength. Until next time, take care of yourself.